Good morning and welcome. It's time now for our interview segment on Monday's edition of Morning Ride. Medicines are meant to heal, relieve suffering, and save lives. However, when the wrong medication is prescribed, the wrong dosage is given, or dangerous drug interactions are overlooked, treatment can quickly become a threat to a patient's safety. The World Health Organization (WHO) identifies medication errors as one of the leading causes of avoidable harm in healthcare worldwide, with errors occurring during prescription, dispensing, administration, and monitoring of medicines. Today we examine the topic when healing turns harmful, the danger of wrong prescriptions. To help us understand the causes, consequences, and prevention of prescription errors, I'm joined by pharmacist Gregson Idibofun. Good morning. How are you doing?
Good morning. I'm doing well. I'm glad to be here.
Yeah, it's good. It's good to have you yet again. All right, let's jump right into it. Now, what exactly constitutes a wrong prescription or medication error?
Well, wrong prescriptions. Anytime a medication is wrongly prescribed, what I mean by wrongly prescribed is either the correct medication for the patient is given, is recommended, but the
Dosage
is wrong, the route of administration is wrong.
Oh, route of administration matters, whether intravenous or oral.
Intravenous or intramuscular or SC, subcutaneous. It also matters too. So we'll come to that. But I know for this topic, we may likely be dwelling much on oral medications.
Okay.
So for intravenous, intramuscular, I think we should also touch that too.
Okay.
So for a medication that should be given intravenously, if you give it intramuscularly, it's also a problem. Or vice versa. Intramuscular medication and intravenous medications being mixed up. So the wrong dose of the medication, the wrong duration, the wrong frequency, these ones, they all constitute wrong prescriptions. So anytime you see this, for example, I'll give an example for an adult that should be taking, let's say a dose of a medication, let's say 500 milligram of a medication based on age and body mass, and that adult is prescribed 100 milligram of that medication. Of course, you know that to start with, it's a wrong prescription, it's a wrong dose. That person would not get the full effect of that medication because you have been given a dose that is lower than normal. And again, so if it's an antibiotic, it now gives room for antibiotic resistance, antibacterial resistance. So all those are things also we need to mitigate against. But wrong prescription, wrong dose, wrong person, wrong patient, wrong frequency, wrong duration, anything that is outside normal for a medication is a wrong prescription.
Okay, so at what stages can medication errors occur? Is it during diagnosis, in the process of dispensing, or the process of administration?
Yes, from the very point where a patient sits with the doctor or the prescriber or the caregiver and fails to give the full details of what his or her condition is. That is where it starts. So if you cannot explain your symptoms, although of course medical practitioners, they are well trained to also help patients, guide patients on how to identify their symptoms and explain them better. But if a patient, because there are some persons that conceal their symptoms.
Okay. Why is that? Are they ashamed or what?
Yes, shame could be there. Yes, stigma is one of them, and what have you. And some of them just normal fear, like if I say too much now, this doctor may recommend surgery or may recommend this. So they want to now mask it and say, okay, yes, it's just light headache. Meanwhile, you have been having consistent headache, having dizziness and vertigo and what have you, but you will not say you have just light headache and you are just slightly tired. If you tell a doctor that you are slightly tired, of course the doctor is going to give you prescription for someone who is slightly tired. That's why you now see prescription like acetaminophen, that's a regular paracetamol, maybe some multivitamins for you to rest well. But ideally, you may need something bigger than that. So that is where the prescription error starts from. So then again, if a patient also is able to explain his or her symptoms to the doctor and probably the doctor misses out some things and recommends a medication that is maybe, of course, in the medical setting, nobody is an island of knowledge. You understand? So it's a thing. So that is why if the doctor makes an error while prescribing, it's not a crime for the pharmacist to detect it and correct it in a professional manner. That is, you need to now, if it's within the hospital setting, you need to now communicate with the doctor that, oh, Dr. Osas or Dr. Greg, we have your patient here with us. He's an adult, 35 years of age, or he's a child, 18 years of age, but with a prescription of so and so drug, 3 gram BD. The recommended daily dose, safe dose for that medication is 2 grams a day.
Okay.
But you are giving 3 grams BD, that is 6 grams a day. So they go, oh, that's true, please. What should okay, please correct it. Or you will say, okay, please send the patient back to me. That is where you have a work environment that is not toxic, where each member understands that they are part of a team. That is how it works. I think I've experienced that while I did my internship and before I set up my own community practice. In the hospitals where I worked, there's always this signage. The doctor brings a prescription, the pharmacist, they will check. Of course, the core of community pharmacy or even pharmacy practice now is what we call pharmaceutical care. So if a doctor makes a mistake, if he gets to your desk as a pharmacist, you must not let that mistake pass through you to the patient. Because it's a bigger crime for you as a pharmacist to let it fly. If Nigeria was a country where litigation is strong, a doctor makes a prescription error and it gets to you as a pharmacist, and you allow that error to fly, instead of going back to the doctor or correcting it there, and the patient takes it, and something happens to the patient and they sue, it is you as a pharmacist that should answer for it first. Yes.
Oh, really?
Because you should know better. If it's medication, yes, you should know better. So they will they will take it harder, it will be harder on you than on the doctor that prescribed that medication. Because medication is not surgery. It's surgery that we can say, okay, doctor, and but medication, as a pharmacy, if you miss it, you should answer for it.
Okay, now you brought in your experience. Now, from your experience as well, what are some of the most common prescription mistakes pharmacists and you have experienced and you people encounter? Is it an issue of dosage? Is it wrong prescription, frequency?
Yes, okay. So all these things you mentioned, we see them every now and then. So we see the prescription errors of dosage. We see that of dosage, as the dose, the frequency, in fact, for some time, the compatibility of the drug medication with the patient using it.
So as a pharmacist, you can see a patient and without interrogating them to know compatibility?
Of course, you should. I'm talking of prescriptions that they bring from prescribers also. We've seen this. So sometimes there are patients that are allergic to certain medications. For example, a patient that's allergic to sulfur-containing drugs. Not sulfur-containing drug, like your common Septrin in quotes.
Okay.
It's a sulfur-containing drug. And the other drugs are that. So for some patients, they are allergic to sulfur-containing drugs. So when you see the prescriptions, there are some medications that you must ask questions when you see them on the prescription. Like, oh, madam, I've seen that they've prescribed for you sulfadozine, they prescribe for you pyrimethamine and the rest. That's Septrin. I'm talking of fancy and the rest of them. So I have to use the brand names so you can get it better. Now, you need to ask questions because you know that some patients will react to sulfur. So you need to ask them.
So how does a patient know?
Of course, there are some drugs you take and you see them with skin. In fact, sulfur reaction is not something anybody wants to experience. But it's unfortunate that some persons they react to it. So, but for you as a person, if you take a medication and you feel instead of getting better, you now feel funny. For example, some people when they take medications, they will continue to have nausea. Nausea is a common side effect of virtually all medications. But for some persons, it's now excessive.
Okay.
Why for somebody take it and they begin to experience skin irritations and the rest of them. So all these are reactions. Once you take a medication and you feel that way, you should know that you react to that medication. Now do you understand better if you react to medication or not? If you feel funny when you take any medication, go back to the pharmacist or go back to your doctor and say, I took this medication and I felt somehow. And doctor will now guide you better. Oh, were you throwing up? Yes, okay. were you having itchy skin, itchy sensation? Say yes, okay. You experienced rashes, your skin was peeling off, and they say yes, okay, fine. So that means what medication they say is, okay, please, you have to discontinue it. So that once they do it in the hospital setting, they will now record it against your folder that this patient reacts to sulfur containing drugs.
And is this communicated to the patient?
Yes, it's communicated to the patient. Patient should know. Every patient has a right to know his or her condition, what he or she reacts to, whether she understands it or not. The patient should be made to understand that, and that folder will guide the patient. So we tell patients, even at the pharmacy, that as you go out, please, anywhere you are buying medication, tell them that you react to sulfur.
Okay.
That's right. But then again, for some patients that have other medical conditions, like ulcer patients, there are some medications that they don't take. So some of the prescription errors we also see are errors like prescribing medications like NSAID, non-steroidal anti-inflammatory drugs, for that painkillers like ibuprofen, diclofenac, and the rest of them. For patients that have ulcer, if they take those medications, it will complicate their ulcer. So we're always careful with that too, except when it is extremely necessary to give that medication. Maybe in cases where the other options are not available and you need to arrest that pain, you just give for short term.
Okay.
While also watching out for how to mitigate in case there is any complication.
So in your practice, I'm talking about healthcare providers generally, be it doctors, nurses, pharmacists, and all of that. When a diagnosis is made, tests are run, and it's time for prescription, after the prescription is written out,
Yes.
is the onus on this, maybe let's limit it to the doctor now, to explain, okay, what I'm writing here, or they'll just hand it to you, take it to the pharmacist to understand? Should the doctor explain to the patient what he has written down? Because why I'm asking this as well is, I want to tie that with how the role of illegible handwriting, poor communication, it plays in all of these errors. Because when growing up, one of the things we tease doctors about is the kind of handwritings they have. And we remember then when we have colleagues that their handwritings are not very legible, we say, you have the handwriting of a doctor. So, and of course, you remember the story my producer was telling us off set of how he got a wrong prescription, but he could not actually trace it when the prescription got wrong. Yes. So, in that situation, apparently, whosoever prescribed these drugs to him did not sit him down and explain, okay, what I wrote here is this and that. So, is that a professional practice? Shouldn't it be explained to the patient before they go to where the drugs are meant to be dispensed?
Well, in standard practice, in standard medical practice, the patient has a right to know the medication you are giving to him or her. This is a right of every patient. Because why it is so is because most patients that come to see you, they also have family members, relatives, friends that are also in medical practice.
Okay.
And sometimes you also need to also be, because it's important, it's a two-way thing. For some persons, sometimes you will not like it because when it becomes too a nosy affair, you've prescribed and say, let me call my friend to confirm, it slows down the process. Now call and that would now say, what did you complain of? It's like that person now starts clicking you afresh. I say, no, they should give you this. One, it does not encourage the prescriber you are seeing there. You understand? That is one. But on the other hand too, is also important, so that in case the prescriber has missed some things, because that your friend or that your relative may know you better, because you'll be freer to discuss your conditions with the person you are close to. You understand? So that's why we encourage people that to have a closer relationship with their healthcare providers, your doctor, your pharmacist, your nurse. Have a close relationship with them so that you will be free. For people that I have on retainership, they are very free with me. They can tell me anything. Both the women, the men, they don't hide anything. Even as far to I picked an infection from so and so okay, you went to, but they are free. You understand? Because however you got infection is not my business. My own is that we need to treat it and also prevent you from passing it to your partner. You understand? So that is it. So they are free. There's nothing like the element of shame. But if you are not free with your doctor, you want to mask something like, if I tell this man that I have an infection like this now, the man will begin to look at me somehow. You understand? So I have church members that also come to see me, and when they tell, I say, my own, as one would leave the church, that is church. Once you come to my pharmacy, it's a different environment. You can discuss anything with me, and I will treat you like a patient, and not like a pastor in quote or a deacon or so in church. As you are here before me, you are a patient. So that relationship.
That's the professionalism.
Professionalism. So now, like go back to the question you asked, the patient has a right to know the medication he or she is being they are prescribing for him or her. Now, why it is important is this. Like you said, we talked about handwriting and the rest of them. If as a doctor you tell your patient that, oh, you have malaria, but from your records you don't tolerate artemether lumefantrine containing drugs, so I'm switching you to piperacin dihydroartemisinin containing medications for this reason. And again, this one, instead of taking it morning and night, you'll be taking it once a day. Okay. Depending on the one they have, there are some that are just single tablet, there are some that are 3 tablets, some that are 4 tablets that you take once a day.
Okay.
You understand? So the doctor will tell you, explain it to you that this is what you are going to be taking. You understand? Once he has told you that, say, this is your prescription, you can go to the pharmacy. Now, he has told you that, and because it's expected that you have enough time to sit with your doctor to talk, to discuss your condition, then the doctor may also let you know that, oh, and please, this drug, when you take it, sometimes you feel like you want to drop. Eat well before you take it. The doctor can do that, in ideal situation. But what we have in Nigerian hospitals is, one, time. When the doctor has like 200 patients waiting for him or her outside to see them that same day between the hours of 8 to 2 p.m., you understand? And if you are going to go by the standard price of explaining everything to the patient, that this and this and that, you will not attend to 20 patients in a day out of the 200. So what they do is, they now have to maximize the time they have. Okay, what do you have? This, okay, this is okay, no problem. Now this thing is now pushed down to the pharmacy. Now at the pharmacy level, that's like I said that if the doctor makes that prescription error, it's not good, but it can be explained. We understand. But you as a pharmacist, now giving that prescription, dispensing that prescription, the medications, without scrutiny, if there's an error, if anything happens to the patient, you have a problem. So at the pharmacy level, you can now explain to the patient, because the pharmacy, they will still do small clerking. Like, okay, what did you complain about? What was your chief complaint? Say, I complained that I had ulcer. Okay, you have ulcer. Did you tell the doctor? Say, why am I not seeing diclofenac here? They say, I don't know. Did you tell the doctor? Are you having severe pain? Is the pain? They say, no, just normal. It's okay, just pain, ulcer pain. It's possible, very important. I've seen cases where patients were prescribed diclofenac for pain. Person had ulcer pain, and he went and they prescribed the diclofenac for the person to. It's pain now. Pain is pain, and they prescribed diclofenac for the person to manage ulcer pain. And the person, fortunately, there's a particular brand, Arthrotech. Not even Arthrotech. Arthrotech person could have tolerated Arthrotech slightly. There's a brand of Nurofen. It's Nurofen, yes. And they prescribed it for the person to come by. I was like, okay, you have ulcer? I say, yes. So what was the pain you complained? Well, is it your leg, your back? I say, stomach. I say, you have
and
ulcer.
And the person communicated this to
yes,
you?
And you have ulcer? I say, yes, that he has ulcer. What are you taking this? I say, he's taking omeprazole. So I was like, really? And you can say, okay, fine. When was the last time you used omeprazole? And he said, he has not used it for like a month or so. I said, that was why the pain became that severe. So, but the person understood pain to be pain that can be managed with painkillers and give diclofenac as a painkiller, which is contraindicated in that person. So it happens. But at the pharmacy level, we spotted that and we now corrected that. Don't know if you have this kind of pain, what we suspect after much clicking, what you have is a ulcer pain. So first of all, you have to resume your ulcer medications. But even if I give you painkiller, it is not painkillers that will complicate your ulcer. There are other alternatives, safer alternatives.
Okay, so from what you've spotted out now, workload pressure plays a huge role in these errors, because the doctor to patient ratio can play a huge role. Then the thing about handwriting. So as a pharmacist, if you don't see the doctor's handwriting, what do you do?
Well,
or you just put one and one together and say, okay,
sometimes you put one and one together, but it's also very risky. If you get prescriptions from a particular hospital, you may have been used to the doctor's handwriting, and like some of our colleagues in Warri, I won't mention name. Once a prescription comes from Central Hospital and they post it on our platform, just say it's Dr. This that wrote this thing. this is what is right. We say, okay, sometimes say, even though you know this is what is prescribed, please, it's better.
So don't you communicate these concern to the doctors? Like make your writings more legible?
Of course they know. We do
or is
that.
it intentional?
Well, sometimes we feel it's intentional. So the patient, again, I have some doctor friends, some they'll tell you sometimes it's intentional because they wouldn't want the patient to abuse the medication. You know, some patients, once they finish one medication, maybe doctor prescribes medication for 14 days. Once they finish it or for a month, instead of going back to the doctor for a second visit, they will just take the prescription, go to a pharmacy or to him and say, please give me this medication. They will now repeat the dose on their own. So sometimes it's intentional. You give, for them it's intentional, but sometimes it's because of time. There is no time. So while they are talking to you, they are writing and the rest of them. So hopefully, if we improve the doctor-patient ratio, this issue of eligible writing also will be mitigated. Then again, to on our own, we also engage with them. We have friends, we still tell them, please make your prescriptions clearer. And so that they tell you, those prescriptions they are complaining that they are not clear, they are not supposed to come out to the pharmacy outside. It's supposed to be within the pharmacy in the hospital, so that if they don't see it, they can always pick their phone or come back with and say, doctor, what did you write here? Please tell us what you wrote here. And the doctor says, okay, this is what I wrote here. And
but sometimes, to be fair to patients, the cost of those medications within the hospital tend to be higher than outside pharmacies, so everybody's considering their pocket. Now, let's move to consequences. Now, what are the possible health consequences of receiving the wrong medication or dosage?
Well, the very first one is adverse drug reactions. If you take a medication that is not meant for you, probably because it was wrongly prescribed and wrongly dispensed, you stand the risk of having adverse drug reactions, anaphylaxis, and what have you, and other complications.
So what was it? Because adverse drug reactions seems like a blanket nomenclature.
Blanket nomenclature, yes. Because what I mean by that is, you take some medication, some patients can experience, let's say, if you say complications, we can classify them as adverse drug reactions. If you are taking the diclofenac, I want to just stick on that, use that one. If you are using diclofenac as for example, and the patient has ulcer, you know, of course, it can lead to adverse drug reactions and other complications like bleeding and the rest of them. And also, if the patient has, for patients that have ulcer, and you are using NSAIDs are also complicated in patients with severe ulcer. It could also exacerbate your, asthma rather. It also exacerbate your asthma, ulcer and asthma. So all those are what we consider when we talk about adverse drug reaction. Then again, there is what we call anaphylactic reactions and the rest of it. For example, you take a medication that you react to severely. You know, some patients you begin to see, is either through a difficulty in breathing. Some of them, you see the manifesting a physical problem on the skin, the face, and the rest of them. So you see, I believe you've seen people with swollen faces because they use certain medications. They come outside, their faces are swollen, their eyes are bulging, you know, excessive stooling, and what have you. Some of them, fluid accumulation, that's edema, pedal edema. The face one is angioedema, swollen face, and the rest of them, because they are possibly used a medication that was wrongly prescribed for them. So then that is one. Then another danger, I would say danger now, that's a combination of wrong prescription, is masking of symptoms.
Okay.
Mask the symptoms. Now, you take, this actually happens mostly with antibiotics and maybe anti-malaria. So if you give the wrong one, of course the drug would also, the drugs are as chemical substances. They will do something. So it's probably they will go there and they will mask the symptoms, and you feel you are getting better, while the disease, the main disease itself, is now gaining ground. So by the time you realize that you're using the wrong medication, the disease has got it. That brings us back to what we discussed about Lassa fever. That you have Lassa fever, you are treating malaria, they are giving you anti-malaria drug, you are treating malaria, anti-malaria, you get better somehow, you feel like everything. Meanwhile, the Lassa is degenerating until it gets to a stage where you need to see all those end stage complications like bleeding from the orifice and what have difficulty in breathing and the rest of them. That actually causes fatality.
Okay, so, okay, you want to answer?
Yeah, that's it. Then I think there's a third complication, which is I've mentioned the adverse reaction and the masking of symptoms. Then of course there is now the last one, which is antimicrobial resistance. You've used the wrong medication, the wrong antibiotic, for example, it now breeds antibacterial resistance, which now makes treating diseases even more difficult and more expensive. So all these are dangers of wrong prescriptions.
Okay. So are there drugs that should not go together? For example, as a pharmacist, you see the prescribed drugs, and you know that if a patient takes this and this about the same time, there might be an adverse reaction in them.
Yes, yeah, there are drugs that shouldn't be used together. For example, I'll go with patients that are treating that are hypertensive. Okay. There are some antihypertensives that shouldn't go together. Of course, in management of hypertension, you have cases where the patient can use 3 different medications, okay, but from 3 different classes. Now, but in some cases, you see, because of nomenclature, some persons can be using a drug in the class CCB, that's amlodipine now, and at the same time, the person is also prescribed nifedipine. They are all
just using medical jargons.
I'm just saying that. So I'm just saying. I want to use that one.
But can you break it down in a way that the common man can understand?
So, for example, if you are using treating hypertension, there are medications that shouldn't go together. For example, now there's a very common one people use. For those that are hypertensive, they will understand this. They call it lisinopril, right? Okay. So, and there's also another medication that people also use. This medication is in the same extended family with lisinopril. We call it like losartan and the rest of them. These are popular drugs. But if you are using losartan, you shouldn't be using lisinopril.
Why?
Because they do similar work.
So it will it can pass for overdosage.
Exactly. So what it does now, it will now increase the effect of that medication, which may not be good for you. But like I said, in some cases, patients can be prescribed 3 different antihypertensives, but belonging to 3 different classes because they are handling specific functions in the management process. But then in other cases too, other medications that shouldn't go well together because of what we call a contraindication, drug-drug interaction. There are medications that shouldn't go together. For example, if you are giving there are some medications that would increase your heart rate, you understand, and you have other medications that you are taking to manage your heart rate. You are not taking 2 of them together. What happens is that they will knock each other off. So there is not good to go to. Then at the same time, there are also medications that would probably they are meant to, we call them caminatives, medications that will calm you down. You are not combining them. In the case where I have to use some names. In the case where you have to use medications containing maybe diphenhydramine now, then you're also using medication like amitriptyline, all this. What it means that it will complicate issues. That it will okay, let me just break it down. Sleeping pills. Okay. Yes, you are using sleeping pills, and you are combining them. You know what it means? So you don't sleep excessively, or you sleep and you don't wake up.
You sleep into coma.
Exactly. So we're always very careful. So when a prescription comes, you will look at the 2 medications. What does this one do, and what does this one do? If you say they are doing similar things, so why are they prescribing the 2 of them together? You understand? So what you do now is to now take the best, the one that does the best work, the safer one, and you can now dispense that one to the patient, while explaining why the patient must not use the other one and this one together.
Okay. For some particular medical situations and conditions, maybe like hypertension, diabetes, asthma, kidney disease, are there particular ways that wrong prescription can affect patients with such chronic conditions?
Yes, it can. Wrong prescription. One, if you prescribe the wrong dose, maybe you prescribe a very low dose, it will not manage that condition.
The hypertension
effectively. And we must be very careful because hypertension can lead to stroke. You understand? It can lead to stroke. Can also lead to kidney complications too. So you must be very careful because if you want to manage hypertension, you are doing it because all those are complications of hypertension actually. So you don't want to get those complications. So you must use the right dose. So if the patient is prescribed a lower dose than necessary, and patient is constantly using it, what it means is that the hypertension is not properly managed. That is one. Then if the patient is also giving excessively high dose, of course that's where question of side effects now comes in now, adverse effects and the rest of that comes in. Now, because most of these drugs, they are broken down, they are eliminated, they are whatever through the liver, they pass through the liver, the kidney and the rest. So if you are overloading these organs, the liver and your kidneys, of course over time they will begin to also feel the effect. You understand? So if you give too high a dose, it's a problem. If you give too low a dose, it's also an issue. So, and for people that are managing all those chronic diseases, like hypertension is a chronic disease, diabetes is also a chronic disease, because most often than enough, people with all these conditions, they live with them for life. So you have to be very careful with the kind of prescription you are giving out and what the person is taking. So a wrong prescription for any of these one, it means that the condition is not properly managed. For diabetes, for hypertension, I mentioned stroke already as one of the complications, heart failure and the rest of them, all those they are there. For diabetes, it's even more severe, because diabetes can also cause stroke, can also lead to kidney disease and what have you. Yes.
Okay, now let's talk about your role as a pharmacist. What safeguards do pharmacists put in place before dispensing medications? What's your SOP?
Okay, fine. For us as pharmacists, the first thing you check out for any prescription that comes to you is to check for the correctness of the prescription. That's the appropriateness of the prescription for the person. So that term covers a whole lot. Is this prescription for the right person? Because there are cases where we've seen mix-up of prescription. Maybe a prescription that was meant for Mr. John now inadvertently falls into the hands of Mr. Peter. And Mr. John is going with the wrong prescription to another place. Mr. Peter is
exactly. So I was going to ask, does the prescription paper capture the information of the patient?
Yes. Sometimes
name, condition that is being...
No, most time prescription paper will not capture the condition.
So how do you know if it's for the right prescription?
Yes, so you don't just give medications. That's why I mentioned something that you do spot clacking. So you clack the patient on the spot too. Okay, you want to know that this medication in a way you make the patient relax. Mr. John, what are you managing? You say, I feel back pain here. Sometimes it radiates to the front and comes to the upper back. Like you're already making getting ideas of what the prescription most likely.
So that tells us that patients should not feel that they are being probed or pried into their issue when the pharmacist is asking you that question, because sometimes you might feel like, I've already told the doctor my situation, why is this pharmacist poke-nosing into my affair?
It's for their own good, because ideally the pharmacist, that's the community pharmacists, are usually the first port of call for every medical condition.
The pharmacist?
So, yes, the pharmacy. The community pharmacy you have around you, when you have challenges, you want to, they are readily accessible. You want to rush down and say, Farmo, please, I'm having this symptom. The pharmacy will look at it, this condition is not something we can handle in the pharmacy here. Please go to the hospital and see a doctor. You understand? So for some of them, for minor ailments, they can handle it at the pharmacy level.
But should that be so?
Yes, that is a standard practice. You should see you can go to your hospital, but the pharmacies are readily accessible.
Okay.
Your community pharmacies, that's what they call the community pharmacy. They are readily accessible. There's hardly any street in Asaba that don't have a community pharmacy. So if you have a community pharmacy, you just quickly this is what I'm feeling. So it is the pharmacy that will not tell you, this is what you need to do. You need to go to this hospital. You are not going to this other hospital. Go to this hospital. This is where they can manage your condition effectively. For example, for a patient that has a condition that needs urgent attention by a specialist, you know where the person can get the specialist. Because this specialist can be seen at the Federal Medical Center Asaba, or can be seen at the specialist hospital Asaba here, and not at General Hospital Okwe. So because you have been in the practice, because the person has come to you, as from your experience, please go to specialist hospital or go to FMC. Because sometimes you want to say, let me just rush down to General Hospital Okwe because it's going to be cheaper for me there. And you go to the place, and after much wasting your time turning you around, and they will not tell you, no, this is your condition. I know the wait time. You wait to see a doctor for maybe about 10 hours or thereabout or so. Then when eventually you see the doctor looks at you and says, this is your condition, is also something you can handle here, go to FMC. You see the time you've wasted. But if you go to the pharmacy that is around you, they know that, this condition cannot be handled in Okwe. You need a bigger, better, a more equipped hospital.
Okay, so back to your procedure, your SOP.
So SOP, so you check for appropriateness of your prescription, the correctness of your prescription, the dosing, the frequency, and of course, you're also going to check for the patient's drug reactions.
Okay.
If the patient has drug reaction, you're also going to check for that. Then the lifestyle of the patient, you also
That is captured in the prescription. The doctor puts.
the doctor will not put those ones.
Okay,
in
so it's
prescription.
based on your interaction.
Exactly,
Okay.
So you also need to ask for lifestyle too.
Okay.
Do you drink? Do you take alcohol? For some patients, they take alcohol. There are medications that they shouldn't take. They shouldn't use at all, or they shouldn't use with alcohol. For example, I know you must have heard what we call disulfiram reaction. But
I've not heard of it. Please explain.
So it is a funny reaction that
Okay.
you get when you combine alcohol with metronidazole. That's flagy.
Oh, okay.
So sometimes we tell them.
So
you
somebody
take alcohol,
consumes alcohol
and
and
you now take that one, you feel
Oh.
funny. So we tell them, don't take this medication with alcohol. If you use alcohol, if you consume alcohol consistently, please try to avoid this medication. So all these are questions that you'll be asked at the pharmacy level as part of their SOP. Then at the time they give you the medication, they want you to feel comfortable enough to also give them feedback, because there must be feedback mechanism. If I give medication to you, even if it's anti-malaria you take for 3 days, I expect that at the end of by the second day, you go with my number. By the second day, if you don't call me, I will call you. How did you feel better? If you tell me you feel worse, I know that anti-malaria is not working for you. There's resistance. That's okay. Please come back. Let's change it to something else. Then that is in cases where you've not had that experience with the patient before, because I have some of my patients that I already know that artemether lumefantrine does not work for them. So once they come down with malaria, I know that this one is either they are taking piperaquine or aterolene containing product, or they are going straight for injectables.
No, you chimed in on this earlier, but I want us to talk about it in detail. Now, what steps do pharmacists take when they discover a potentially harmful prescription, and also put that side by side with the importance of collaboration between doctors, pharmacists, and nurses? Then we also look at the peculiar situation where the pharmacist, where the patient goes to get these drugs, is outside the medical facility where the prescription was made. I don't know if it's too much on you,
No,
or
it's
if
okay.
you got
It's
it.
okay. I got it. So in the hospital setting, there is usually collaboration. I mentioned before that in standard practice, there must be synergy among the healthcare workers, the doctor who is the prescriber, the pharmacist who dispenses, and the nurses who would administer the medication if they need to administer them. Now that's in the situation where the patient is either an inpatient, he's in the hospital, maybe he's on admission, or is ambulatory. You come to see the doctor, you get your medications, and if they need to administer a dose for you in the hospital, you take it to the nurses who would administer.
Okay.
Or they will now guide you on how to take the subsequent one, like you must look for a pharmacy around you, get a nurse around you to administer this medication. So now, if there is a prescription error spotted, now what's the ideal situation, the ideal thing to do is, as a pharmacist in the hospital setting, for standard practice, the doctor's information is contained. So because every prescription is signed.
Okay.
So they have a directory where you have all the doctors' information, their names and their phone numbers. So once this happens, you just quickly go through. I think FMC, they use systems now, so it's easy for them. Just go through, type in the doctor's name, and the doctor's information comes out. It's either you use that medium to communicate to the doctor that, doctor, this, we have your prescription here. And that's what, sometimes this thing happens without the patient even knowing. While you are sitting in front of your desktop, you are typing, you and the doctor you are communicating, say this operation is this, the patient is an ulcer patient, but he was prescribed diclofenac, 100 milligram BD. And okay, please, I think this is contraindicated in ulcer. It's okay, that's, I didn't, sorry. Okay, what do you have? Within this, just between the two of you, sorted it. That is standard practice. Then if that is not possible, then you can write the information out, and you go and see the doctor yourself. If you are a pharmacist, the doctor will know that once you knock, they want to see, they will prioritize it. They know there's something important. So you tell doctor, this thing, this and this and this, I think they are contraindicated. But okay, please correct it. He's professional. But when you start saying, why would this doctor prescribe this kind of thing? The doctor doesn't know what he or she is doing. It's offensive, because one, you are belittling the doctor before the patient. And what it means that it will erode the confidence the patient will have in that doctor subsequently, you understand? And the patient will leave there and say, FMC doctors, they don't know anything. They don't know anything. Then if there is a slight thing, they'll say, we'll talk. That is how they keep people. Last time they gave me, but you do it in a professional manner. The patient doesn't have to know that there is an error. You sort it with the doctor, and that is it. Then, in cases where you've gotten the prescription, but you feel it was not clear enough so that it doesn't confuse the nurses, you as a pharmacist, you should be able to clarify that this injectable they are giving to this patient will be given in smaller quantities. They can say give a patient an IV infusion, 1,000 ml of an infusion, but you know that infusion cannot be rushed for that patient. So what do? You now bring that, say, no, give this thing in timed, give it in timed as timed doses. You can give 250 ml over 30 minutes. Then you slow down this so that it can run for. You must explain it. You understand? Yes, that's what you must, because as a pharmacist, you are not in charge of the frequency of the medication, the dosing, and the rest of it. Once it comes from the doctor, you take over from there. So the pharmacy is now the central point. Anything that has to do with medication, the pharmacist is the central point.
Okay.
So because the error coming from the prescriber, you must handle it. Then it's also a duty for you to now explain in such a way that the person administering it would do the right thing.
Okay. Before we delve into
sorry, I wanted to answer. Then in the cases where the pharmacy is outside,
yes,
and the prescription comes in, of course you don't know the patient. Probably you don't know the doctor. You are not familiar with the doctor. If you ask the patient and the patient doesn't have the doctor's number, it's now your duty to now do what you should do, the right thing. Because you know that the patient needs his medication. And one is either you send the patient back to the hospital, in which case it will take a longer time for the patient to get audience with the doctor, if the patient doesn't have a relationship with the doctor. Or on your own as a pharmacist, from your own experience, you know that this patient has ulcer, this was what he complained to the doctor, because you now need to do a fresh clacking for the patient. And probably this was what the doctor intended to prescribe for the patient. Okay, now
so by the clacking, you mean like
it's more like that. Probe it, yeah, exactly. You must probe it. You must probe, but you probe it in a professional manner, so it doesn't give the patient the impression that there is something wrong with the prescription.
Okay. Okay. So now, before we talk about patient responsibility, something you mentioned earlier, means of administering medications, intravenous, intramuscular. Let's talk about that and put that side by side with. You talked about alcohol and flagyl not going together. I've also heard in time past, fizzy drinks, soda. Is it wrong to use a fizzy drink to ingest a drug? Because sometimes, maybe the drug, the taste is not pleasant. So yes, you want something sweetened in case the medication leaves its taste on your tongue. You have something sweet that's flushing it down. Put that side by side with also even cold water. I don't know how true. Some persons have said it's not good to use cold water to take oral medication. How true are these?
And quickly are the ones that put their tablets inside lump of fiber.
Okay, as well.
I will start from that first one, the injections. Now, there are medications that are meant strictly for intramuscular administration because of the fatty tissues you have there.
Okay.
Oily injections, for example, that's a lipid soluble injection. Like there's one with the anti-malaria Imal, alpha beta theta. You don't give it, and some other anti-malaria, you give them IM because of the lipid, the content. It will go better. Yeah, but if you give that
medication,
intramuscular, yes, that's the one they give you here or here.
Okay.
But if you are giving that medication IV intravenously, it's a problem because it could block your veins. You understand? Because it's not meant for intravenous.
So you say most malaria medications
intramuscular. Then there are some that you can give both intravenously and intramuscular. So that is about. That means when you go to a pharmacy or to the pharmacy to buy medication, ask them, is this medication for IV use or for IM use? It's important to ask because
that's for injectables.
For injectable, yeah. A few months ago, we had a complaint on our platform from a nurse administered this Imal intravenously, and she has administered it for 3 days, a complete dose, before she now realized that it was not supposed to be intravenous but intramuscular. She was running up and down to look for solution. We're like, okay, you've given the patient that did not die now, so just look for. So it was an issue then, you understand. Wow. But good, thank God the patient is still alive. It didn't cause any complication. But that was just it was chaotic then in that hospital up north.
Wow.
So that brings us to the point where
so it was the pharmacist that made the error.
Not the pharmacist, it was the nurse that administered it.
No, but the pharmacist should have. Talking about pharmacist giving proper description.
No, this thing didn't even go through pharmacy. It didn't even go through the doctor even to start with. You know how we have all these our our setting in that's why I said the doctor-patient ratio in the country is very poor. So there are some hospitals that are manned, maybe the doctor is not, they are manned solely by the nurse, by a nurse, and it may not be a registered nurse, but you know, what we call auxiliary nurses or CHU, community health extension workers, and the rest of them. So once you have this people in that place, now your life is in your hands, so to say. So then cases where you mentioned using fizzy drinks to take medications and the rest of them. We don't recommend that actually. All those carbonated drinks, you know, we don't recommend it.
Do they really have any adverse effects?
Yeah, they may. There's food. There are some medications that do not go well with food. You know, you don't take them with food. There's food-drug interaction. So if fizzy drink, we'll consider them as food. They are carbonated. They're carbonated. So we don't recommend them. But you can take, after you've taken your medication, you can take a sip if you want to. If you feel like you want to mask the taste. Or what I recommend to people is, if you want to do that, get gum. When you've taken your medication, take gum and chew. So that's why in most pharmacies, they also have chewing gums. As you buy medication, buy gum. So if you don't want the bitter taste, once you swallow, you can just throw one or two inside your mouth and chew. It will also help you to mask it. Then those are used to swallow medications. There are drugs that interact with, I mentioned it before. So what happens is that as you take that food in, of course, the food would go through digestion process faster than the drug. Okay. So as the food is being digested, broken down, the drug is also affected. Because some drugs, when you take drugs, they have time for disintegration, then absorption, before they will now be transported to the tissue cells where they are needed, you know, then eventually they will now be eliminated from your body. So, but when you take them in lump of eba, what you are doing now is that whatever enzyme that is coming to digest of the soul sees everything as food. And attachment medication.
But is it not supposed to now hasten the effects in
your
system?
No, it's not that. It's not supposed to. The drugs are timed. They have timed disintegration. So if it's too fast, it's an issue.
Wow.
If it is too slow, it's also an issue. So you want to be careful about that. I know probably some person.
I have a lot to say, but we're out of time. So, but let's round off with this. What can patients do to protect themselves from prescription errors generally?
One, the first thing the patient should do is to be truthful to himself and to the prescriber.
Okay.
Don't conceal information. Divulge of every information, every health information you should divulge to the prescriber. Then secondly, when you get to the pharmacist, be calm, be relaxed. The situation we see in hospital is that after spending some time with the doctor, waiting, not even spending time with the doctor, after spending time waiting to see the doctor, they may spend like 3 hours to see the doctor. They see the doctor maybe 10 minutes or 15 minutes. Then they come to the pharmacy, they want to pick their job within 30 seconds. So that will leave room for error. So if there's any error, 30 seconds is not enough for a pharmacist to scrutinize your prescription and to advise you properly. So if you are in a rush, give my drug, doctor, I've seen my drug, and they pack your drugs the way it was prescribed. If there's any error in that prescription, you go and take the wrong medication, and it will probably come down with adverse drug reaction and the rest of them. That is one. So patients need to be calm in the hospital setting when they want to see the pharmacist, because they know their life at that point is in the hands of the pharmacist. If, for example, a pharmacy gives you a medication like that has narrow therapeutic safety index, drugs like digoxin, and you take digoxin, they tell you take it 2 gram BD, that's what was prescribed. And the pharmacist did not spot it because you were in a hurry. And you go and take that one, and your heart collapses, is on you. So patients must be very patient when they get to the pharmacy, so that the pharmacy will also do their work to scrutinize, spot prescription errors, and advise appropriately. Then, outside the hospital setting, we also want to encourage patients, when you are prescribed the medication, after you've gone through the pharmacy scrutiny and everything is okay, please take the medication as prescribed. They said medication is for you to use BD. Use it BD. Don't say, I took it in the morning, I felt better.
What's BD?
Twice a day. I took
BD?
it twice a day.
Okay.
I took it in the morning, I felt relief. Then I took it in the evening, I felt another relief. But in between the afternoon, I felt small slight pain. So tomorrow I'm going to take it 3 times. You don't decide that, you understand? Because the medications, they are not miracle workers. They will take time, to work. So the pain will, if you are treating pain, the pain will reduce gradually until it's no longer there. Then, don't share your medications. Your medication is personalized to you. So don't say, I had headache last time, I had some fever last time, and I took this medication ABX that was prescribed by the doctor that I got from the pharmacist, and I was fine. So now that my child or my husband is having this symptom, please come and take this one, I still have some of them, or let's go to the pharmacy and buy ABX so that you can take it, because after that was what I took last time, and I was better. Now you must consider that the person you are this person in question may have other health conditions that will require, proper clicking. For somebody that has kidney issues, the medication you take may not be appropriate for that person.
Okay.
Somebody that has liver issues, the medication you take may not be appropriate for the person. Then for somebody that has diabetes, the medication you take may also not be appropriate for that person. So you don't say because you have these symptoms, similar symptoms that you had last time, the person should go and use that medication, use that, that's safe medication now. But then again, get your medications from the right source. Yes. Some people, they get their medication prescriptions from online. They go to online, they ask Google, what I'm feeling this, what can I use to treat this?
And nowadays, AI.
AI. Even AI also has disclaimer that you must see a doctor.
Okay.
That whatever AI is telling you is not final. You also need to see a professional. AI understands that it is not absolute. Okay. You must see your doctor physically, your pharmacy physically, before you take all those medications. So please, internet is not a doctor. Internet is not a pharmacist. So you must consult with your doctor and your pharmacist for you to get safe prescriptions so you can get better.
All right, thank you so much, Pharmacy Gregson Idibafun. I know we can keep going on and on. I want to believe that the producer will bring you back, because we also need to look at fake drugs, then expired medication and all of that. But I believe that you have really done a great job this morning educating me and the viewer on when healing turns harmful, the danger of wrong prescriptions. Now, the conversation highlights that while medicines remain one of the most effective tools in healthcare, errors in prescribing and medication use can have devastating consequences. Patient safety depends on vigilance from healthcare professionals and active participation from patients, like he has rightly said. We do appreciate you for being a part of this interview segment, and this will put a plug on Monday's edition of The Morning Ride. It is I, Ogaga Ikama, thanking you so much for your time.